Vinpocetine is an alkaloid derived from the compound vincamine. Vincamine is the main ingredient of the lesser periwinkle plant, Vinca minor, a common garden plant. In several countries, including Japan, Mexico, Russia, and many in Europe, vinpocetine is prescribed for the treatment of cognitive and circulatory brain disorders such as a stroke or dementia. Vinpocetine has historically been used in Europe as a way to enhance blood flow to the brain in the treatment of cognitive decline, stroke recovery, and epilepsy. More recently, it's been picked up by the nootropic community for its potential to enhance memory and cognition. Vinpocetine boosts circulation. It can slow cognitive decline. It has possible benefits for memory, reaction time, hearing loss, and headaches, and it's generally safe when taken at the standard oral doses. Vinpocetine influences the flow of important electrolytes by inhibiting several types of ion channels: the sodium channels, the L-type calcium channels, and the potassium channels. These ion channel interactions can result in decreased neurotransmitter release, like dopamine or glutamate. Excess dopamine and glutamate in the brain can kill the brain cells due to over-excitation or excitotoxicity, and it can increase oxidative damage. Therefore, vinpocetine is thought to have a neuroprotective property by decreasing the amount of dopamine or glutamate that's released in the brain. Vinpocetine also inhibits PDE1. Blockers of this enzyme have the potential cardioprotective and cognitive boosting properties. By increasing cGMP concentrations, they widen the blood vessel and it increases blood flow. Additionally, vinpocetine can lower inflammation by inhibiting IKKB activation, as well as the transportation of NF-kappa B across the cell membrane. Vinpocetine has been shown to interact with alpha-adrenergic and TPSO receptors. The effects of the vinpocetine action on these receptors is not yet fully understood. In humans, vinpocetine has a bioavailability of around 6% when consumed in water-based solution. For example, ingesting vinpocetine with a meal, regardless of its composition, rather than in a fasted state, can increase the bioavailability by 60 to 100%. Certain delivery systems, such as liposomal delivery, can also increase its absorption. One study found that a topical vinpocetine patch was twice as bioavailable as an orally ingested vinpocetine. Upon consumption, vinpocetine is quickly metabolized into its active metabolite, cis-apo-vincaminic acid. Vinpocetine is excreted after being metabolized. This is why no residue can be found in the urine, only its metabolites. Vinpocetine is detectable in the blood within 20 minutes of consumption. Oral administration with 5 mg of vinpocetine resulted in peak blood levels of approximately 64 nanograms per milliliter. Its half-life is around 1.4 hours. Vinpocetine is undetectable in the blood 2 to 3 hours after ingestion, and it binds to proteins in the blood at rates from 86% to complete binding. Blood levels of apovincaminic acid, vinpocetine's main metabolite, peak within 1 hour after consumption and return to normal within 3 to 4 hours. Vinpocetine does not accumulate in the body when moderate oral doses of 5 to 30 mg per day are ingested. Studies in primates and humans have shown that vinpocetine can pass through the blood-brain barrier. Vinpocetine is rapidly absorbed in the human brain, with 3 to 4% entering the brain within 2 minutes of an IV dose. After consumption, vinpocetine appears to increase in the human brain more than in the rest of the body. Vinpocetine has a special affinity to specific areas of the brain, such as the thalamus, 24% higher than average, the basal ganglia, the putamen, and the visual cortex. These brain regions receive the most additional blood flow in response to taking vinpocetine. Increasing brain blood flow and oxygenation. In 6 healthy men, an infusion of 20 mg of vinpocetine resulted in a 7% increase in the blood flow to the brain. Vinpocetine also improved brain oxygenation in 700 individuals with brain circulatory issues. It improved blood flow without altering the average blood pressure. This enhanced the blood flow, and it's linked with cognitive protection based on 2 studies on 46 people who are recovering from strokes. Vinpocetine can also increase microcirculation in the brain, as was seen in a pilot study on 30 people. It probably does this by enhancing the red blood cell flexibility and therefore reducing blood viscosity. All in all, the evidence suggests that vinpocetine increases blood flow in the brain, and this may be beneficial for people who are recovering from a stroke. In a clinical trial on over 200 people with dementia, a treatment with vinpocetine at 10 to 20 milligrams 3 times a day for 4 months improved their overall cognitive performance, and it reduced the subjective rating to their severity of illness. 1 week of intravenous infusions of vinpocetine, followed by 90 days of a 30 milligram oral dose, significantly improved the symptoms of cognitive decline in a trial on over 4,000 individuals with poor blood circulation in the brain. For example, their physical balance was remarkably improved. Another study gave vinpocetine to 20 patients who were aged 50 to 78 with low blood flow to the brain. The rate of cognitive decline slowed significantly based on the results of speech performance tests, and subjective measures of well-being also improved. The TPSO system, a sensor of brain injury and microglial activation, is upregulated in people with cognitive impairment or brain trauma. By activating the receptors in the TPO system, vinpocetine might be able to reduce the activity of the system and thus reduce cognitive decline. In a small pilot study on 12 healthy women, 40 milligrams of vinpocetine taken 3 times per day improved memory and memory scanning speed. In another small trial on 8 healthy volunteers, vinpocetine counteracted the short-term memory impairment that was caused by a sedative. The inhibition of sodium and calcium channels leads to memory improvement. Vinpocetine's inhibition of these ion channels may explain its memory-enhancing properties. Vinpocetine may also increase memory by long-term potentiation, the strengthening of synapses based on recent patterns of activity based on a study in guinea pigs. Another way that vinpocetine may enhance memory is by affecting alpha-adrenergic receptors in the brain. In a small trial on 12 healthy female volunteers between the ages of 25 to 40, 40 milligrams of vinpocetine per day significantly reduced reaction times from approximately 610 milliseconds to 430 milliseconds. In 2 studies on 140 people with hearing loss caused by nerve damage, vinpocetine, both alone and combined with ganglioside, improved the condition in 73 to 80% of the patients. In guinea pigs, vinpocetine given at 2 milligrams per kg injections offers protection against hearing loss caused by taking antibiotics. In a clinical trial on 126 people with tension headaches, vinpocetine combined with acupressure and other drugs, like the muscle relaxer Zanaflex and the antidepressant Prozac, provided some relief. The treatment was more effective when it also included the antioxidant amoxicillin. In mice with a deficiency in the ApoE1, or apolipoprotein E, 5 milligrams per kg of vinpocetine given every other day almost halved the amount of plaque in the arteries. This improvement was likely due to a reduction in the receptor for the oxidized LDL, and thus less LDL oxidation occurred. The process of atherosclerosis is associated with vascular smooth muscle cells proliferating, and this worsens with atherosclerosis. At 5 milligrams per kg, the vinpocetine reduces the vascular smooth muscle cell proliferation by 50%. Vinpocetine given orally at 2 to 8 milligrams per kg reduced elevation of liver enzymes ALT, AST, and ALP caused by a liver toxin in rats, At the highest dose of 8.4 mg per kg, there was an 82% reduction in liver cell death. Vinpocetine at 5 mg per kg per day had potent anti-inflammatory effects in mice. Vinpocetine may exert its anti-inflammatory effects by inhibiting IKKB and reducing the transportation of NF-kappa B across the cell membranes. Vinpocetine reduced the loss in mitochondrial membrane potential, which is needed to create ATP, or adenosine triphosphate, the energy source in the body. This is caused by overactivation of neurotransmitter receptors, or excitotoxicity, in brain cells. Similarly, high blood levels reversed the decrease in the mitochondrial function that was seen with beta-amyloid pigmentation in a cell-based study. Vinpocetine blocked certain sodium channels that are associated with pain in 2 studies in brain cells. In mice, 10 to 20 mg per kg of injected vinpocetine reduced breast tumor growth and caused no adverse effects. It possibly did this by interfering with the cell cycle and inhibiting the activation of certain signaling pathways and proteins. The standard dose is 5 mg at each of the 3 meals, with 20 mg per meal seen as a high dose. This dose range is suitable for the purpose of neuroprotection, enhancing cerebral blood flow and reducing the rate of cognitive decline. Other dosing recommendations are 10 mg taken 3 times per day. Remember that vinpocetine with meals will enhance its absorption. For more information about nootropics, herbs, supplements, or health conditions, check out my website.